The upcoming dissolution of Ontario's COVID-19 Science Advisory Table. That has raised some concerns and questions. Students going back to the classroom. Also, we're talking about fall illnesses and long-term care. All of this in mind, the director of the Science Advisory Table, Dr. Fahad Razak, joins me now to talk about all of this. Good morning to you.
Hi, good morning.
I want to begin with the idea of the advisory table being, the words are being chosen very carefully, not being dismantled, not being dissolved, but rather the work will continue, but in a different capacity. So can you break that down on what that actually means?
Yeah, absolutely. I mean, first, look, it's been an absolute privilege. So we were struck up right at the start of the pandemic. I was one of the original members and then became the assistant director and director over the last year. The group that has been together over this time is stopping within the next couple of weeks. And my understanding is that Public Health Ontario and our ministry will be creating other additional advisory groups down the road. The details of that haven't been released yet, so just not clear what that will be.
Is this the right timing for this? Does it work, technically still in a pandemic? Would this help the general public?
Yeah, important questions. I don't have all those answers for you. I can say that I believe that we are at a very high risk period. I know you've had me on before saying that, but with the school year, with the amount of virus that's circulating, depending on if you look at the number of tests that are positive right now or the number of people in hospital, we may have 5 up to 10 times higher levels right now, August 2022 versus August 2021. And obviously people are very worried about that, myself included, and seeing hospitals struggle as they are right now going into the fall and winter, which is traditionally when hospitals start to see a surge, not in August. So I think it is going to be a very challenging fall and winter. That said, there are many scientists and other advisors in this province. So I think the government and Public Health Ontario do have a lot to choose from.
You mentioned that there is concern, obviously, with school coming up. Masks are not being mandated. Do you believe this is the right move at this point?
So I just want to be clear on masks that masks absolutely work. There's no debate about that. And mask mandates do reduce spread in children in schools. That's been assessed by Public Health Ontario review just this year. What the question is right now is the mandate. So the mandatory requirement, should it be required of every child? That's a risk threshold question, and scientists and public policy and government come to different questions. My personal feeling is that I think masks are very effective and should be used early in the course. So I would like to see masks required. But again, that's my personal feeling. And even the Science Table report couldn't reach consensus on this because scientists do differ on that.
What are your thoughts on some post-secondary institutions mandating booster shots to attend or to live on residence?
Yeah, so some universities have required it recently. Again, you're seeing this spread because there's some advantages and disadvantages. So some of the advantages are if you have a population that's fully vaccinated, the severity of illness tends to be less overall, at least for the early part of the immediately after they receive that booster. There is some reduction of transmission. On the other hand, we do know at this point that given most students are at least two-dose vaccinated, plus have also likely been infected in the last 6 months, it's not clear that there is durable long-term benefit from it. And this is why there's some disagreement on it. I can understand why universities are doing it, but I do understand why others are not as well. And it's a period of transition of the science right now.
Mm-hmm. Doctor, we're going to be watching a little bit later on this morning. The opposition is holding this emergency public hearing when it comes to the Ford government's latest bill regarding elderly patients and transferring, but we're also keeping a very close eye on long-term care homes. Your thoughts on these facilities right now, what is being done, what more needs to be done to protect our most vulnerable?
Yeah, look, there's always more that can be done. I have to say that what happened in Canada, not just Ontario, but what happened in Canada and in Ontario during the early part of the pandemic was a travesty. What happened to elderly members of our community in long-term care. And so we need to do more to protect them. I think a lot has been done over the last couple of years, but even in this Omicron wave, you start to see a rise in sickness and death among the elderly and in long-term care. And so I think there has to be more. Now, I'm certainly not a long-term care expert. I think you've had a lot on your show. But this is the group that is historically the most vulnerable. And as we head into a fall and winter, I think we have to look very carefully. For example, I'd like to see accurate and up-to-date reporting within the long-term care sector so that we know very early in the course if something is happening.
Dr. Razak, appreciate you taking the time and for all of the work that you've been doing throughout this pandemic. Thank you.
Thanks. It's a real privilege. And of course, we're still here to answer questions. So please reach out anytime.
Oh, you just opened that door. We will. All right. Talk to you soon. Thank you.